TK to YouTube. All right. The ear. Guys, the ear. How we hear and how we stay at equilibrium. Okay. The ear is a really important structure, okay, that we have. And we're going to talk about all the different things that we need to talk about here, okay? So, the way the ear works, okay, is it's divided up into 3 different sections, okay? That being the outer ear, the middle ear, and the inner ear, okay? The inner ear, in my personal opinion, is where things can get a little wonky, okay? And the reason because of that is, 1, because of all the fancy, things that we want you to know. We have a lot of things here we want you to be able to, identify them and know what they are. And then 2, I think it's just because of all the crazy names that these have, okay? We have the scala vestibuli, perilymph, cochlear duct, a lot of crazy names here, okay? So the quantity and the names of these things can get really confusing, but we're going to try and break them down for you, especially with the couple, models that we have here, okay? But we're going to move down. We're going to start from the outer ear, work our way all the way to the inner ear, okay? So we're going to start from easy, work our way to the most difficult stuff, okay? So apologize for the email there. So outer ear, okay? So we have an ear model here, outer ear, 2 things we want you to know, okay? So the outer ear is basically everything that we are able to see for the most part, okay? So, everything that we can see from the naked eye. So without having to use an otoscope to look inside the ear, okay? So outer ear is, the thing we can see. The entirety of this thing here is called the auricle. Okay, the auricle is basically just like the ring structure that comes with the ear, okay? So there's a couple other names for all the, some of the other things here that we don't want you to know. Like we have the pinna. We don't really need you to know that. Or the tragus. We don't need to, know that. The antihelix, all that stuff. We just want you to know that this entire thing on the outside, the thing you can touch, is called the auricle, okay? The auditory canal is basically just this entire ear hole, okay? So they call it here the auditory meatus, or the auditory canal. When I was in school, I learned, I called it the external acoustic or auditory meatus. Here, they just want you to call it the auditory canal. So it's your ear hole, goes all the way to the inner part of your ear, okay? So that's all the inner ear, okay? So let's scroll down here just so we can decipher this, okay? Outer ear, everything you can see, including the auditory canal. Middle ear has all these fancy structures here, the tympanic membrane, the ossicles, all that fun stuff. Okay, let's talk about that. So let's zoom in here so we can see these things a little bit better on our anatomy model. Middle ear here, tympanic membrane, classically known as the eardrum. Okay, tympanic means drum. Okay, the membrane is what the actual drum part structure itself is. Okay, so it's what it's what shakes every time that we have vibrations that come in our ear. Okay, so that's this guy. All right, so the tympanic cavity then is everything on the inside here, okay? So it's the middle ear chamber, as a lack for better words, okay? Tympanic cavity. So tympanic membrane, tympanic cavity here, okay? So tympanic cavity, what sits inside these guys are these little ossicles here, okay? These very small bones, okay? Actually, the smallest bones in our body, believe it or not, the ossicles are. That's what they stand for, little bones, okay? And they have some fun names here. They are called the malleus, respectively. So we have the malleus here, we have the incus, and then we have the stapes right here, okay? So what the malleus means is hammerhead, okay? It means the hammer, okay? The incus is the anvil, because if we think about it, a hammer always hits on an anvil to create sound, okay? Now the anvil, okay, the incus connects to this guy right here, okay? Stirrups, like the stirrups of a horse, okay? What you'd put your foot into when you're riding a horse, okay? The stirrups connects to this fun little structure over here, okay? Vestibule and the cochlea, okay? Which is where the name comes, the vestibulocochlear nerve, okay? Cranial nerve number 8, okay? So, when sound comes through the ear, what's going to happen, okay, is it's going to travel all the way from the auricle, the outer ear, it's going to go through the auditory canal. It's going to vibrate this tympanic membrane, okay? So, when it does that, what's going to happen? It's going to vibrate it. It's going to cause these ossicles to vibrate, okay? So the hammer is going to hit onto the anvil. The anvil is going to transmit that sound through the stapes, okay? And it's going to go into this structure, which we'll talk about in a second, called the cochlea. So that sound is going to get transmitted into the cochlea, which is how we're able to process our hearing, okay? So that's what that is, right? So those are the ossicles there, okay? The auditory tube is this guy down here. also known as the eustachian tube. All right. So if you guys are ever wondering why, when your ears or whenever you're sick, have like a cold, flu, maybe you had COVID in the past, something like that. If you're ever wondering why your ears, feel like they're plugged or something like that, it's because of this guy. Okay. This eustachian tube, when it gets filled up with mucus or stuff like that, it gets plugged up. So they tell you, what is it? Yawn. They tell you to swallow, chew some gum or stuff like that. That helps to, open up this airway to allow for, your ears to be able to not be so pressurized so they can pop, okay? So it is the channel that links the cavity from the middle ear to the nasal part in the upper respiratory system. It is formed partially of bone and partially of cartilage and fibrous tissue, and it is lined by a mucous membrane, okay? So most of the time, the tube is closed, but it is open during swallowing and yawning, which is how you depressurize the ear, essentially, okay? Equalize the pressure in the middle ear to the air of the outside pressure, right? So those are the middle ear structures, all right? So we have tympanic membrane, tympanic cavity, we have the bones here, so we have the malleus, we have the incus, we have the stapes, and we have the auditory tube, all right? So middle ear. We can see those guys also on this drawing here as well, okay? So everything we just talked about. All right. Let's dive into the inner ear. And like I said, this is where things can get a little bit wonky because it's all new stuff, okay? All stuff that can get a little confusing, but we're going to break it down for you, okay? And this picture isn't going to do it much justice. We'll have to scroll down and talk about some things too, okay? So cochlea. Cochlea is the spiral-looking structure on the inside of our ear, okay? This is what is primarily responsible for hearing, okay? This is the primary structure that we use for hearing. This other guy, the vestibule, is used for equilibrium, and we'll talk about that when we get down there. Okay, but let's talk about the cochlea first. So cochlea, hearing. A couple things we need to know for it, okay? So first thing we need to know is this guy right here, okay? The foot plate, all right? Also known as the oval window, okay? This is where the stirrups sits right on top of, okay? This foot plate. And we can see it much better. Where is it? Where's that picture that was really good? I saw it earlier. The stapes foot plate, okay? It's also known as the oval window, which I know I saw it. Yeah, stapes in the oval window, okay? Right here. So also known as the oval window, okay? So when the stapes vibrates, okay, what the oval window is going to do, okay, is it's going to connect, it's going to transmit the sound from the middle ear, so from the stapes to the inner ear, aka to the cochlea, okay? That's what the oval window is going to do, okay? So it does that. Come back up here. We have some fancy new terms here called the scala vestibuli, cochlear duct, and the scala tympani, okay? All of these things are three different structures, okay? Three different pathways inside of the cochlea, okay? So let's zoom in here real quick. Zoom in really, really deep. So, stapes transmits the sound, okay? All of this green stuff here, okay, is called perilymph, all right? Perilymph. So, it is fluid that is similar to cerebrospinal fluid, but it helps transmit sound. This fluid lines the scala vestibuli and the scala tympani, okay? The blue structure is the blue fluid. That is the cochlear duct, also known as the endolymph fluid, okay? So that's what that is. So, scala vestibuli. All right, let's scroll down here. It is the superior chamber. So it's the superior chamber in the cochlea, okay? So this guy always sits on top. Always sits on top, as you can see here, okay? Scala vestibuli with the perilymph, with that green stuff, okay? The inner chamber, the cochlear duct, has the endolymph, as highlighted in blue here. And the scala tympani, okay, is the one that is on the bottom. So it's the inferior tunnel, okay? The scala tympani also has perilymph. So perilymph is only in the scalae structures, the scalas, okay? And then the cochlear duct only has the endolymph, okay? So perilymph and the scala, endolymph, cochlear duct. All right, so those guys there. And these are all chambers that we use to transmit the sound, okay? So, structures, once again. So, scala vestibuli, we have the perilymph, we have the cochlear duct, endolymph, scala tympani, perilymph, once again, okay? One extra structure inside of that cochlear duct, okay, I didn't talk about, is this guy right here, the spiral organ, okay? This is what turns mechanical sound. So what we hear, okay, this is what's turning that mechanical sound into electrical signals for our brain, okay? And as we can see all these little nerves as they come and innervate that spiral organ, okay? So as that sound brushes over the top of that spiral organ, it takes the mechanical sound that we're hearing, transmits it, into an electrical signal, and then sends it up to the brain. Okay, so you can't really see it too well on here, and I don't think we don't have an unfortunate like breakdown of the model here or anything like that. But just know that the cochlear nerve, the vestibulocochlear, innervates the cochlea, has little, very, very, very tiny nerve fibers that come into the spiral organ, okay? Takes the mechanical wave signals, turns it into electrical, transmits it back up to the brain to be able to interpret, okay? That's what those three structures are, okay? And for better understanding, this is what's happening, okay? This is the cochlea if it was unwound and laid out straight, okay? So if we were to unwind the spiral organ here, laid out straight, this is what would happen, okay? So sound, right? Sound comes right here, vibrates the tympanic membrane. It's going to transmit signals from the malleus to the incus to the stapes. Stapes transmits the sound through the oval window. And the arrows here show the direction that it's going, okay? So it always starts in the scala vestibuli, okay? And then it moves through the endolymph in the cochlear duct, okay? This red here, okay, that red little area, that's the spiral organ, okay? So it's taking the signals, taking the mechanical sound, transmitting it into electrical signals to dissipate the sound, okay, so that way we don't have reflections of it. After the sound is finished in the cochlear duct, it gets transmitted into the scala tympani, okay? Exits a little hole over here, okay? Which it's not labeled here, but it's called the round window, okay? Let's scroll up here so we can see it. So oval window here, this is where the stapes sits on top of, okay? Stapes sits here, transmits all that sound. The oval window, let's see if we can see that. Let's see, where am I looking here? Oval window, here we go, round window, perfect, right there, okay? So as I was saying, so sound comes in here, perilymph, goes through the scala vestibuli, goes through the cochlear duct, then comes back through the scala tympani, and we follow this guy all the way around, and we can see how it exits through this round window here, okay? Now, this is where sound exits through, so that way we don't have reflections of the sound going back through our ear, which is why it doesn't echo or stuff like that, okay? So really, really important, okay? Really, really important structure, okay? Allows for sound to be exited so we don't have reflections of it, okay? Okay, that's how sound works. Sound is really, really easy, okay? Sound is super, super easy how it works. So, goes in, vibrates the tympanic membrane. Where's that guy at? Right here. Vibrates the hammer, the malleus. Vibrates the incus, the anvil. Vibrates the stapes, the stirrups. Vibrates the oval window. Goes into the cochlea. And remember, it goes through the scala vestibuli, the superior chamber first. Then the blue one, right, the cochlear duct, vibrates over the top of that spiral organ, transmits that sound from mechanical to electrical signals. An extra sound is dissipated through the scala tympani, and it exits through the round window, okay? And that's it. Super easy. So a couple different steps there that it goes through. But like I said, it's really, really simple once you break it down, okay? All right. That's sound. Let's talk about equilibrium here, okay? So equilibrium is a little bit different. So cochlear sound, vestibule, okay, does equilibrium. A couple different things we want you to know with it, okay? So the vestibule is comprised of two things, the saccule and the utricle, okay? They're not well defined. Actually, they're not defined at all on this thing. You can't, identify them in particular. But what you can do is if we scroll down here, you can identify the utricle and the saccule respectively, okay? So, utricle, all right, is the one that's on top, all right? Saccule is the one that's just a little bit below it, okay? We can see that here, okay? So, let's see a little bit better here. So, saccule, okay? One that's on the bottom, utricle is on top. And it always goes, if you're looking at this thing, okay, on the model, if you're talking about the cochlea first, if you want to know which one's which, always goes in alphabetical order, okay? So you have cochlea first, and then it would be the saccule, so cochlea, then the saccule, right? Do your ABCs, S, and utricle after that, okay? So what they're responsible for, okay? They're both responsible for equilibrium, but they differ based on the directions you're going, okay? So what the saccule is responsible for for equilibrium, particularly in the vertical direction. Okay, so if you're going up and down in an elevator, okay? Utricle is for horizontal, all right? So for moving back and forth in a car, for example, okay? That's what those guys are responsible for. Semicircular ducts, okay, are called that because they have circles, okay? We have 3 of them, all right? We have one in the anterior, all right? It's called superior here, but this would be the anterior. You have one in the posterior, you have one in the lateral, okay? Let's look at them down here. So we can see those guys, semicircular ducts, all right? Lateral, anterior, posterior, okay? And then they're also labeled here respectively. Anterior, lateral, posterior. And we showed you guys on the models in class how to identify them in more depth, okay? But also note that inside of all of these guys, so the utricle, saccule, semicircular ducts, they also have the perilymph inside them too, okay? It's not just the cochlea. So they're there respectively, all right? So looking at these guys here, semicircular ducts, what these guys are responsible for is for angular acceleration, okay? So angular, so for rotating, okay? So angular acceleration. So not linear now, for angular motion, okay? So more 3D related motion, okay? So that's what those guys are responsible for. So labeling the ear here, all right? Label those structures, the tests here, and of course we have eye anatomy, all right? So ear is very straightforward, okay? I think it gets a little wonky, like I said, when you get to the inner ear, but like I said, it's very simple once you break it down, okay? Always start from the outer ear, work your way to the middle ear, and then the inner ear, and then just break everything down then, okay? And if you want to talk about, how is sound, okay, how is it transmitted? Always start from the outer ear, work your way in, okay? And then remember, sound comes in, tympanic membrane, vibrates the malleus, which vibrates the incus, which vibrates the stapes, which vibrates the oval window, and then it vibrates to the scala vestibuli, and then the cochlear duct, and then it vibrates over the top of the spiral organ, vibrates through the scala tympani, and exits through the oval window, which I don't know if we can see that guy too well on here, unfortunately. See, no, that's the internal carotid. Yeah, I don't see the oval window on here, unfortunately. I'd probably have to do a deep dive, but I don't want to do a massive deep dive for that right now. Okay. All right. Well, guys, that's it for the ear. Very straightforward. Come back and talk about the eye. All right. Also very straightforward here, but we'll break it down once again because there's a lot of things on here that can get a little confusing, but we'll break it down for you super, super easy. Okay. All right, guys. I'm going to see you back in a few minutes. Talk about the eye. Go from there. All right.